You're watching WDSU News Channel 6 on your side.
Well, as we all know, summer is here and that means more time in the sun. But if you're not careful, you could put yourself at serious risk for skin cancer. So we're activating our on-call network with WDSU News Channel 6 anchor Melanie Hebert and Touro Hospital.
It is summertime, and that means most of us will be spending more time outside and in the sun. So 6 is on call today, joined by Touro dermatologist Dr. Sharon Meyer, who will explain what we need to know about protecting ourselves and our families from the summer sun. Good to see you, Dr. Meyer. First of all, let's start with the overwhelming number of choices when it comes to sun protection, sprays and lotions, and so many range of numbers of SPF from 15 to 100. So how do you decide which product is right for you?
Well, that is a difficult concept to grasp, and first of all, we have to realize that most of us only put on about half or 1/4 what we need. So if the sunscreen says 50, you're not really getting a 50. You might be getting a 25 or even less. So number one, put it on before you go out in the sun, and put on at least a shot glass full for your whole body. I think anything over 30, 40 is enough as long as you put it on adequately.
So 15 isn't enough for your face?
No, it's not.
That's what's in my makeup, actually. So I guess, are you opposed to makeups that have SPF or lotions in them, or should you also use an additional sunscreen?
If you're just putting on a 15 in your makeup to go to work and you're not really getting any sun, that's probably okay. But if you're walking the dog for an hour after work, I think that's not enough, because you're probably getting equivalent to a 5 or a 7. Wow.
Well, but besides SPF numbers, what else should consumers look for when buying sunscreen?
Well, the SPF only talks about the UVB. That doesn't even include the UVA. And so the best ingredients to look for are zinc oxide, titanium dioxide, avobenzone, which has also additive Mexoryl to make it last longer. It's funny, I was in a meeting the other day and I just did a round table and asked the other dermatologists what their favorite sunscreens were. 2 of us said that we liked zinc oxide and titanium dioxide. One doctor liked Neutrogena with Mexoryl, and the other dermatologist liked one called Durascreen, which lasts about 8 hours.
If it says dermatologist.
Well, of course, you can tune in tomorrow, and of course, we're on call with a physician from Touro Hospital. See why breast MRIs may be more effective than mammograms when it comes to fighting and finding breast cancer.